To Monday as a lot of us go back to work. First full week of 2015. Can't believe it's already here. It's going to be a chilly one. Temperatures in the upper 40s, low 50s on Tuesday. We have some cold nights ahead, so get the firewood ready. You'll certainly need it.
All right, Heather, thank you so much. Well, Dr. Justin Turner joins me now for today's Medical Matters Chat, and we're talking about being healthy for the new year. It is the one time of year that everybody, or just about everybody, at least thinks about doing something different for their health. What do you recommend?
Well, I recommend several different things. The first one I recommend is actually getting a good primary care physician. That's very important because depending upon what medical conditions you may have, there's certain diets that you probably can and cannot do as it relates to exercise. There's certain things that may limit you from being able to do certain exercise, especially if your heart is not in good health. So first and foremost, make sure you have a good primary care physician and you've had a general wellness checkup.
Okay, so you do need that, and everybody needs that. You know, even if you don't go every year, you really do need a primary caregiver. Everybody needs that. We had that, you know, years and years and years ago.
Right.
People have gotten away from that.
Right.
You know, but if you go to a specialist, you've got to remember they're a specialist.
They're specialists.
They're not a general health physician for you.
Exactly, and you know, we take our vehicles to our, the automotive shops to get regular oil changes and different things like that. That's prevention. Well, that's the same concept that we need to take as it relates to our health, which a lot of us don't do.
All right, one thing that we also don't do, which is probably one of our biggest problems, is we don't eat well.
Right.
What do you recommend for that?
So a lot of patients say, Dr. Turner, well, I need a specific diet. Can you help me out with that? What diet is the best? And like I said, it does differ depending upon what medical conditions you have. But let's talk about hypertension because that's a condition that affects most Americans. Like 1 out of 3, and 1 out of 3 don't even realize they have it. So as it relates to specific diets and making sure that your sodium intake is not too much. The average daily recommended allowance is about 2,300 milligrams of sodium. And depending upon if you have certain conditions such as diabetes, heart disease, if you're 51 and older, if you're African American, the recommended intake is 1,500 milligrams or less. But I myself was a patient at one time, about 3 years ago, went to the doctor's office. I thought I was just going for that general checkup that I just mentioned, and lo and behold, my blood pressure was like 150/95. So as most of my patients are, when I tell them that same news, they're in shock. Oh, well, doctor, I was rushing, or well, maybe it was because, I'm stressed.
It's your fault.
Exactly, but it was repeated over a course of several minutes, and it stayed high. So my doctor at that time sat down with me, and we discussed a treatment plan. I started paying attention to those things that I was eating, and I was going to Red Lobster at least probably about once a month, one of my favorite spots. I love seafood. Had no idea that each one of those biscuits have about 380 milligrams of sodium in it. And if you're busy like me and you're rushing, you wait until you're starving, you may tend to, your eyes may be bigger than your stomach. So it was nothing for me to eat maybe 3 or 4 biscuits right there eating. And then having a salad and putting ranch dressing on that salad. Had no idea that a tablespoon of ranch dressing has about 110 milligrams of sodium. But most of us put way more than 1 tablespoon of dressing on our salads.
And that doesn't even include the calories.
That doesn't include the calories or the meal. So then I would pick shrimp scampi. I would always get the pick 2. Depending upon the day, maybe pick 2 or pick 3, but shrimp scampi, the shrimp Alfredo, as well as the snow crab legs. And the shrimp scampi, 1 serving of shrimp scampi has about 1,000 milligrams of sodium in it. The shrimp Alfredo, the fettuccine Alfredo itself, a half a portion, about 1,400 milligrams of sodium. So if I had high blood pressure and my recommended amount was no more than 1,500 milligrams, I'd already exceeded that in just 1 serving that day. That doesn't include the snow crab legs. That doesn't include what I had to drink, because a lot of us consume a lot of carbonated drinks, and that has a lot of sodium in it as well. So that's one thing, making sure our diet, we're keeping up with our the labels. Most of us don't look at the labels.
Well, and the labels are changing too, so that's going to be more prevalent to people. I mean, so that they can see what they're getting. But also, so that information we've got to search out if we don't have it.
Right.
But we also have these fitness trackers now, which are a bevy of information if you use them.
Yes, I'm so glad you mentioned that. So there's a ton of resources out there. There's a quote that says, where there's a will, there's a way. And I truly believe that. I was looking on the internet last week, and there's a fitness tracker. It tracks how active or inactive you are. It tracks how many calories you burn, even tracks your sleep pattern to see the quality of sleep you're getting. That's very, very important, as about I think 16 million Americans have sleep apnea and don't even realize it. And that's contributing towards obesity, diabetes, hypertension, and all of those other things that can affect your health in this new year.
All right, Dr. Justin Turner, thank you so much. Your office is up in?
Our office is at 5240 Robinson Road Extension.
Okay.
You can go to www.turnercarems.com and we can take care of you from there. So just want to wish everyone a happy but also a healthy new year.
All right, Dr. Turner, thank you so much and appreciate you being here as always. We'll take a look at your first alert forecast, but here's a look at what's on tonight here on WLBT.